calcitriol dry eye therapy, antimicrobial peptides, and COVID eye infections. This is the first part of a multi-part discussion about the interconnection of these issues. We will be discussing how existing calcitriol dry eye therapies could possibly be repurposed for the treatment of COVID eye infections. In this presentation, we will be discussing the impacts of local COVID infections on the cornea and other portions of the eye, as well as the impacts of distant COVID infections on the physiology, immunology, and endocrinology taking place in the cornea. Ophthalmologists are very concerned about COVID eye infections. The eye can be a primary site of COVID infection. The eye can be a portal of entry for COVID virions to pass from the eye through the tear ducts into the nasal cavity. In progressive COVID patients, COVID RNA and COVID spike proteins have been localized to the corneal epithelium. Key points for this presentation. First, the cornea can become immunocompromised during COVID infections. 2. CoV2 RNA and CoV2 proteins have been found in the cornea. 3. The expression of defensin genes, alpha defensin genes and beta defensin genes, have been found to be depressed in the nasal epithelium of COVID patients. 4. Antimicrobial peptides inactivate the COVID spike protein. 5. Increasing the secretion of antimicrobial peptides, such as the defensins and the human cathelicidin LL37, using calcitriol therapeutics, could help suppress COVID pathogenesis in the eyes, tear ducts, and nasal cavity. This is a hypothesis. Let us begin by reviewing the impacts of COVID infections on the kidney, particularly the upstream elements of nephrons. It is now known that in progressive COVID infections, the glomerulus is injured and impaired, leading to a loss of the filtration barrier, proteinuria. In addition, the proximal convoluted tubule is impacted, resulting in a depression of function, including probably the synthesis and secretion of calcitriol. This is known as an acute Fanconi syndrome, which is secondary to COVID. We will discuss how the impacts of COVID on the functioning of nephrons and the onset of an acute Fanconi syndrome lead to a dysregulation of the endocrine system and its impacts on the innate and adaptive immune systems. We will discuss how an immune endocrine dysregulation resulting from injury to the kidney can potentially result in corneal pathogenesis. The concept is that COVID kidney damage, by impairing the secretion of calcitriol, could impair innate immunity in the distant corneas of the eyes by altering the secretion of antimicrobial peptides in these sites. This is the hypothesis. To examine the integrated impacts of COVID infections and COVID therapeutics on corneal physiology, we will review about 20 papers from the literature, which include recent COVID publications, as well as older literature pertaining to the immune functions and structure of the cornea, tying this to what is known about the vitamin D receptor signaling pathways. In this paper, the authors describe the presence of CoV-2 RNA in the cornea of viremic patients with COVID infections. Below is a paper describing the presence of CoV-2 proteins in the cornea of a COVID patient. This paper describes the prevalence of SARS-CoV-2 in human postmortem ocular tissues, describing several ways by which this was confirmed. As mentioned earlier in the talk, we will be examining how calcitriol dry eye therapies could be potentially repurposed for the treatment of COVID ocular infections. This paper provides an excellent review of the histology, innate immunity, and biophysical dynamics that take place in irrigating the ocular surface with tear fluids, which include calcitriol secreted from the lacrimal gland. This brings us to the vitamin D biosynthetic pathway and the impacts of activated vitamin D, calcitriol, on the physiology and integrity of various visceral organs. In short, vitamin D3 is synthesized in the skin in response to sunlight. It can also be ingested through the diet. Vitamin D3 is inactive until it passes through both the liver and kidney to become hydroxylated into 1,25-D, calcitriol. Calcitriol can also be synthesized locally within various epithelial cells as well as immune cells. The vitamin D pathway can be referred to as the calcitriol VDR pathway, vitamin D receptor pathway, a signaling pathway which has profound impact on many functions of the body, including vascular health, the integrity of the endothelium, various organs such as the parathyroid gland, and the functioning of the heart and the activity states of myeloid immune cells such as macrophages, monocytes, and microglia. In the case of COVID, as we have described, there is an onset of acute Fanconi syndrome in response to the impacts of the COVID infection. This probably results in a drop in calcitriol secretion from the proximal convoluted tubules, leading to a calcitriol deficit in the serum. This calcitriol deficit will have major impacts on the inflammatory trajectory of various tissues. Again, this would be a consequence of the establishment of an acute Fanconi syndrome, which is secondary to the COVID infection. All of this results in an immunoendocrine dysregulation, which can potentially result in corneal pathogenesis. The hypothesis is that COVID kidney damage, by producing a suppression of calcitriol synthesis from the proximal convoluted tubules, will result in a calcitriol deficit in the serum. A calcitriol deficit in the serum will impact the lacrimal glands, the tear glands, from secreting calcitriol to the ocular surface. A lack of calcitriol irrigating the cornea will impair its innate immunity, leaving it susceptible to viral, bacterial, and fungal infections. Let us now examine how calcitriol 125-D impacts multiple features of the innate immune system. Here are a variety of actions of vitamin D response elements, the upstream elements located in the promoter of vitamin D responsive genes. There are approximately 2,000 vitamin D responsive genes in the human genome. Among these are a number of antimicrobial peptides, including defensins and the human causalicidin molecule known as LL37. In a number of viruses, these antimicrobial peptides are known to inhibit the docking of the virus with cell membranes, uh, altering the viral capsid membrane, and inducing host cell responses that are antiviral, making the tissues and cells non-permissive environments for viral replication. The antimicrobial peptide LL37, besides having antimicrobial activity, also promotes angiogenesis, wound healing, and acts as an immune modulator. In the human cornea, LL37 is upregulated in response to calcitriol stimulation 125D. This is extremely important in understanding how adequate levels of calcitriol in the tear fluid could help suppress the infection or propagation of a COVID infection in the ocular tissues. Recently, LL37 has been found to inhibit the docking of the COVID spike protein to its cellular receptor, the human angiotensin converting enzyme 2, ACE2. This is done through a surface plasmon resonance spectroscopy system, and these show two spectrograms illustrating the inhibitory actions of LL37 on the docking and binding of the spike protein to various portions of the ACE2 receptor. The LL37 antimicrobial peptide is positively charged. It has an excess of 6 positive charges, allowing it to bind to the surface of the viral spike protein and inhibit its steric interactions with the ACE2 receptor. The authors of this study emphasize that LL37 offers a very potent therapeutic avenue to suppress COVID spike protein interactions with the ACE2 receptor. We will now look at other antimicrobial peptides which impact the interactions of spike proteins with ACE2 receptors. During the last year, numerous groups have been designing antiviral nasal sprays to combat the COVID infection in the nasal epithelium. It may be possible to incorporate calcitriol solubilized with ethanol or DMSO into a therapeutic anti-COVID nasal spray. The concept being calcitriol is able to upregulate a number of antimicrobial peptides, which include a variety of defensins as well as LL37. Recently it has been reported that numerous defensin genes, alpha defensin genes and beta defensin genes, are downregulated in the nasal epithelium of COVID-infected individuals. This is extremely important because defensins typically are upregulated in response to viral infections. Here, there is a dramatic and significant suppression of defensin expression in this infected tissue. Placing these recent results in context with an earlier paper dealing with COVID SARS-1, the effects of an antimicrobial peptide, theta-defensin, from a rhesus monkey. Theta-defensin was applied intranasally into a mouse model of severe acute respiratory syndrome resulting from a coronavirus infection. A intranasal dose of theta-defensin immediately prior to the COVID SARS infection, also delivered intranasally, dramatically reduced death in this mouse model. The authors of the study determined that the theta-defensin RTD1 did not inhibit the SARS-CoV-1 directly. Instead, the theta-defensin appears to reduce inflammation and modestly reduce the severity of lung histopathogenesis at day 2 and day 4 assessment points. I encourage the viewers of this presentation to pause and read the details of this study. These graphs are from the same paper, illustrating benefits to applying defensin immediately prior to intranasal inoculation of the mouse with SARS-CoV-1. Again, theta-defensin was found not to bind to the spike protein of the coronavirus or block infection. However, theta-defensin altered inflammatory processes that took place in response to the viral infection. In B, one sees a substantial survival benefit from applying theta-defensin prior to the inoculation of the SARS-CoV-1 virions. So antimicrobial peptides provide two substantial benefits in combating coronavirus infections. First, certain antimicrobial peptides like LL37 are able to bind to the spike protein of the coronavirus and block its ability to bind to the H2 receptor. Other antimicrobial peptides, such as theta-defensin, appear to moderate inflammatory processes, resulting in a modest drop in histopathogenesis, but a major improvement in survival benefit, at least in a mouse model. How does that pertain to ocular to nasal cavity transmissions of the coronavirus CoV-2? So COVID eye infections are believed to take place through a direct contact of virions transmitted through aerosol particles or through hand-to-eye contact, transmitting the virions from a surface directly to the cornea. The ocular surface is therefore a potential portal of entry for the coronavirus to enter the nasal cavity. Once virions are suspended within tear fluid, they can be quickly moved into the nasolacrimal ducts via the mechanical actions of blinking. Once inside the nasolacrimal ducts, hydraulic forces can quickly deliver the virions to the efferent opening of the tear duct, which lies at the anterior end of the inferior meatus, which is the lower passage inside the nasal cavity. Here, the virions could infect the nasoepithelium directly, or they could be moved by hydraulic fluids or sneezing to the superior aspect of the nasal cavity, infecting the olfactory epithelium. Alternatively, the virions could move from the anterior end of the inferior meatus in a posterior direction, entering the oral pharyngeal cavity and eventually draining from those epithelia into the lower respiratory system. Adding therapeutics into the nasal cavity, the ocular tissues, as well as the nasolacrimal ducts is an important strategy to impede the early stages of the COVID infection. For this reason, it is important to analyze the full impacts of calcitriol on the innate immune system in ocular tissues. Starting with the literature on a condition known as dry eye, an inflammatory condition that may or may not be connected with microbial infections, it has now been determined that calcitriol supplementation, oral calcitriol, is an effective means of treating dry eye, particularly corneal inflammation. And this has been established both in vitro and in vivo. So the condition of a calcitriol deficit in tear fluid will also be linked to a deficit in LL37 within the cornea because calcitriol is linked to the expression of this antimicrobial peptide. LL37, besides having antimicrobial activity, is involved in angiogenesis, wound healing, and immunomodulation. What happens during the course of a COVID infection in terms of calcitriol deficits and corneal LL37 deficits? It is now known that oral calcitriol can rapidly upregulate the expression of the antimicrobial peptide LL27 within the corneal epithelium. This has been established in a rodent model. Conversely, one can conjecture that a sudden deficit of calcitriol would result in a downregulation of LL37. A deficit of corneal LL37 could set the stage for a secondary infection. Numerous cases of ocular fungal infections have now been reported in recovering COVID patients. This is paralleled by reports of fungal infections within the sinuses in post-COVID patients. We have discussed the importance of calcitriol as a stimulus to increase the synthesis and secretion of a number of defensin antimicrobial peptides, as well as the LL37 antimicrobial peptide. In the final portion of this presentation, we will discuss a number of clinical issues that pertain to the use of calcitriol therapeutics and their potential use for treating COVID pathogenesis in the eyes, tear ducts, and nasal cavity. To do that, a quick survey of current literature reveals that calcitriol, besides inhibiting the nuclear factor kappa beta inflammatory pathway, which is upstream of cytokine production, calcitriol also inhibits a reactive oxygen species signaling pathway that activates an antioxidant signaling response to hyperosmotic stress. This takes place in human corneal epithelial cells. Calcitriol also modulates cellular proliferation in certain cancers, and calcitriol has been used as a therapeutic agent for certain types of cancers, such as prostate cancer, for many decades. There are important lessons to be learned from the application of calcitriol in these circumstances. Turning back to the antimicrobial peptide LL37, this review of its actions in autoimmune diseases and viral infections illustrates its pleiotropic actions. Not only does LL37 have direct inhibitory actions on virions such as the CoV2 virion, it also modulates the activity of numerous types of immune cells, including macrophages, mast cells, neutrophils, T cells, and dendritic cells. It also alters the behavior of epithelial cells. So in considering calcitriol as a therapeutic agent for COVID conditions, there are numerous potential benefits illustrated here in the context of inhibiting viral replication, viral entry, and viral propagation. In addition, the modulation of host cell phenotypes to make them non-permissive environments for viral infections. In that context, let us now discuss the specific use of calcitriol for ocular infections, such as the case discussed in this recent case report, which reports corneal edema and chorotic precipitates occurring in the eye of a patient recovering from COVID. So the secretion of defensins and the antimicrobial peptide LL37 may offer a means of inhibiting the type of pathogenesis described in this case report. To understand the impacts of calcitriol on any organ, tissue, or physiological process, it is essential to understand the epigenetic landscape and epigenetic backstory to the current set of conditions. In the case of nephrons within COVID-impacted kidneys, there is substantial damage to glomeruli, which results in loss of filtration selectivity and the condition known as proteinuria. There is also damage occurring to the proximal convoluted tubules. The net result is a loss of calcitriol synthesis. This is particularly acute when there is damage to the brush border of the epithelial cells within the convoluted tubule. So, calcitriol is a first-line intervention for Fanconi syndrome, whether it is a genetically based Fanconi syndrome or a drug-induced injury Fanconi syndrome. So the question is, can calcitriol be used as a first-line intervention in the case of COVID kidney? This question needs to be analyzed by endocrinologists in consultation with nephrologists and internists. This is a systems and integrative physiology issue. Here are 8 issues that are linked. First, damage to proximal convoluted tubules will produce a serum calcitriol deficit. This calcitriol deficit will produce numerous types of dysregulation within the endocrine system. The innate immune system will become dysregulated in response to the endocrine system becoming dysregulated. A dysregulated innate immune system will produce tissue immunodeficiencies, which set the stage for secondary infections. In parallel, there is progressive oxidative damage occurring in tissues from prolonged hyperinflammation. Inflammation, as well as drugs such as steroids, have metabolic impacts on the functioning of mitochondria. Although mitochondria will still be able to produce ATP, it is the impact of steroids on the synthesis of calcitriol that needs to be considered, not only in the kidney, but in every tissue and immune cell in the body. This brings us to an overview of the vitamin D calcitriol biosynthetic pathway and the impact of calcitriol on the functioning of the innate immune system. For COVID, it is essential for practitioners to recognize two key failure mode points in the synthesis of calcitriol. The first takes place in the liver, and the second takes place in the kidney. Cholecalciferol, vitamin D3, is transferred by vitamin D binding protein and to some extent albumin delivered to the liver where it is hydroxylated into 25D. This is the metabolite which is often used to characterize vitamin D levels in serum. However, in an inflamed liver or a liver that has been treated with steroids, there is an upregulation of a hydroxylase, 24-hydroxylase, which will attach a second hydroxyl group to 25D, making 24-25D, shunting it towards excretion. This is the first failure mode. It is known as a metabolic shunt. 24-hydroxylase can also be upregulated in the kidney. So when 25D is transferred to the kidney to be hydroxylated into 125D calcitriol, 24-hydroxylase can also act at this point, creating 1,24,25D. This is again another example of metabolic shunting. Overall, this leads to a synthesis deficit of calcitriol. So these are known as conversion failures of vitamin D metabolites, resulting in an overall calcitriol deficit. Therapeutic intervention, calcitriol supplementation. Under the circumstances of COVID, it is unlikely that calcidiol by itself or vitamin D3 will be effective in progressive COVID patients. Early on in the infection, both vitamin D3 and calcitriol may be of substantial benefit, but when 24-hydroxylase is upregulated in the liver and the kidney, the metabolic shunting towards excretion is likely to be dominant. A good review of these issues is summarized in this recent meta-analysis. It reviews decades of mixed results obtained from the use of various types of vitamin D metabolites for various disorders. Again, it is essential for practitioners to review the endocrinology of the entire vitamin D biosynthetic pathway before deciding on interventions for COVID. How can calcitriol be utilized to prevent or treat ocular conditions arising from COVID infections? Certainly, oral calcitriol is an immediately available therapeutic intervention that should be able to help boost antimicrobial peptides within the cornea. I would encourage practitioners to consult the following references in guiding their discussions and interventions. This is one of the most thorough and up-to-date reviews on the use of calcitriol used in combination therapy with other agents that prolong the actions of calcitriol, its half-life. And this is results of decades of research for the use of calcitriol in prostate cancer therapies. This recent paper on calcitriol illustrates success in using calcitriol to treat dry eye conditions, both in vivo and in vitro. This paper describes the success in using 0.25 micrograms of calcitriol per day for 1 year to successfully treat osteoporosis in postmenopausal women in China. Finally, this paper describes the secretion of calcitriol in tear fluid and links the levels of calcitriol in tear fluid to serum levels of calcitriol. In summary, I have modified this diagram from a recent review to illustrate the impact of 24-hydroxylase and failure mode, which will likely occur in COVID conditions. It emphasizes the role of mitochondria. In the inner membrane of mitochondria, numerous hydroxylases are placed in the inner membrane. They are known as the CYP gene products, CYP. 24-hydroxylase is encoded by CYP24A1. This illustrates the need to utilize the knowledge of epigenetics to understand the omics surrounding COVID infections, metabolomics, transcriptomics. The liver metabolite, 25D, is brought to various locations. One, the kidney, where it is hydroxylated into 125D calcitriol. This becomes a systemic source, which is exported through the serum. If the kidney is injured by direct and indirect actions of COVID or impacted by steroid therapeutics, an upregulation of 24-hydroxylase will lead to a block, a metabolic block in calcitriol. Calcitriol, after it's synthesized, will be immediately hydroxylated into 1,24,25D and exported for excretion. This also occurs in local synthesis of calcitriol, which takes place in epithelia and immune cells. Again, the upregulation of 24-hydroxylase leads to a metabolic block, preventing autocrine and paracrine production of calcitriol. The downstream effects of this in this local synthesis pathway are profound. It leads to a lack of anti-inflammatory tone and a lack of antimicrobial peptides, overall resulting in contributing to hyperinflammation and immunodeficiencies, particularly in the innate immune system. So, considering calcitriol synthesis conversion failures, this term conversion failure means converting the 25D metabolite into functional calcitriol, 125D. Physicians should be looking for these metabolites in the urine and in the serum, 2425D3 and 12425D3. These are the products that result from the actions of 24-hydroxylase. These are the prima facie evidence of the upregulation of 24-hydroxylase, not only in the kidney, but throughout the body, epithelial cells, and immune cells. All of this fits into the overall view of an evolving calcitriol crisis occurring during COVID infections. Key points from this presentation. 1. The cornea can become immunocompromised during COVID. 2. CoV2 RNA and CoV2 proteins have been found in the cornea. 3. Expression of defensin genes is depressed in the nasal epithelium of COVID patients. This may be because of a deficit of calcitriol in the serum and in local production. within the nasal epithelium. 4. Antimicrobial peptides can inactivate the COVID spike protein. A good example of this is LL37, which blocks the spike protein's ability to dock and bind with the ACE2 receptor. 5. Increasing the secretion of antimicrobial peptides using calcitriol therapeutics could help suppress COVID pathogenesis in the eyes, tear ducts, and nasal cavity. This is the working hypothesis. In the second portion of this discussion, we will examine how to boost antimicrobial peptides using calcitriol therapeutics. Calcitriol dry eye therapy is a starting point for these discussions. We will discuss current formulations, solubilizations of calcitriol, delivery modalities, and timescales for the changes in transcription of antimicrobial peptides, RNAs. All of this will fit into a broader discussion of COVID eye infections and connect to COVID pathogenesis throughout the body.